we went into the ultrasound, and we found out that we were looking at the screen, and it looked like a cat. You know, it had the slit in the lip, and I said something to the ultrasound technician, and I said, you know, why does it look like a cat? And she was like, yeah, hold on real quick. And she goes running out of the room, and she comes back in with the doctor, and that's when I kind of knew something was going on.
Mrs. Peterson had received a prenatal diagnosis of a probable cleft lip and palate. I don't believe she had ever known a child herself that had a cleft.
Not knowing, we thought, has anyone else ever gone through this before? You know, and lots of other families have, and
Lots.
You're not alone.
I'm definitely not alone.
One of the things we do is we like to look at pictures of newborns that have clefts so parents know what to expect.
She took out an album of children, you know, that they had repaired the cleft lips and cleft palates, and that was, you know, reassuring to show us the before and after pictures.
His first challenge was feeding, because it's very difficult for babies who have clefts to feed efficiently.
So Cullen had his initial lip repair as an infant, and he had his initial cleft palate repair also during that first year of life.
You get used to seeing that, and you kind of fall in love with it. It's kind of a unique trait that your child has.
We did. We fell in love with that little cleft, and we were kind of, you know, when they wheel him off, next time he came back, we knew that he, you know, wouldn't have it anymore. So that was kind of emotional. You know, there's other parents who have gone through this, and it's not as rare as what we had thought it was. They let us know that they were going to be there for us every step of the way.
We are concerned about how kids look, feel, and function. We want them to look, feel, and function their very best. We may meet families when they have a new diagnosis during a pregnancy, which is often a very difficult period for families as they come to grips with what these things mean. And we want them to understand that we want to be the one number that they can call. We really pride ourselves on being able to help families with every aspect of their child's care.
A cleft is an opening or a gap in a child's lip, in their gum ridge, and or in the roof of their mouth and their palate. A lot of these children are younger children where if you can't understand what they want, you know, it causes a lot of frustration and, you know, behavioral breakdowns both for the parents and for the children when they can't communicate with each other.
It can become a concern for the self-esteem, especially when they reach adolescence. It's going to be also a concern for the function in terms of speech, in terms of also function of the mouth.
Just listening to a child can tell us a lot about what might be happening inside their mouth that we may or may not be able to see. And then I can use that information with the team to talk about what type of medical or therapy intervention they might need.
And the importance is that the care is coordinated. And the team is going to play a central role in coordinating the care so it's not duplicated or it's not missed.
There are usually 10 to 15 families at a clinic, and it's really nice because parents get the chance to sit down, talk to other families, share some of their experiences, and then the kids get to meet each other, and that's also really a special type of situation because many of our children don't ever have the chance to see other children like themselves. They're going to see many different healthcare providers and specialists. Some of the meetings will be individual and some will be in a dental group. Everybody's in the same place, so there's not a lot of running around to do. We try to make it easy for families. It's more like a one-stop kind of shop.
In that setting, it's very easy for me to go across the hallway and see the family alongside my colleague, and we're available together to answer all of their questions.
We really want to reassure all of our families and children that there's nothing painful, nothing's going to hurt about their visit in the morning. It's just a matter of talking, maybe some examinations, but nothing painful and scary for children. After your child's evaluated, the entire team sits down together and goes through all of their different findings. They all share the same need, and that's for coordinated and integrated care. It's not a matter of just seeing your child, getting them through the surgery, and then they're finished. We know that it has to be a staged approach. Things have to be dealt with as children develop.
We have plans for kids until they're completely done with growth.
So we like to tell our families that sometimes we think we'll be growing up together.
We like to imagine them sitting, interviewing for college or interviewing for a job, and making sure that we've done everything at every time point to make sure they look, feel, and function their very best.
It's just nice when you do go to the craniofacial clinic and you talk to other families that are there, you know, who their children are going through each step. So it is comforting to sit with them and talk to them and see each other's children, and they're continuing to progress.
He's doing beautifully. He's now 5 years of age, and we follow him usually every 6 months to a year in our team.
And you just see your child progressing, and you start to see, okay, he's gonna be okay.
We're really happy with how Cullen has done. He hasn't required any speech therapy. He feels very good about himself.
It's just nice now that he's a normal 5-year-old little boy, and I don't even think it phases Cullen.
He's getting ready to enter kindergarten, and we want him to be functioning as well as possible and is ready for school.
I would tell any parent that's going to have to go through with it, it's not as bad as you think it is.
I mean, just let them grow and develop on their own, and
Absolutely.
they'll make it through.
Yep. Just love their smile.
Yeah.